Okay, now we're going to take a look at the SI joint. Now, the SI joint doesn't have any specific muscles that move it in the sense of independently. The hip has a lot of action, a lot of movement of the SI, or the muscles of the hip affect the SI greatly. But I'm going to just separate testing the SI joint from the hip for this little show. So what I want to do first is I'm going to sit down here and get more relaxed, and I'm going to just find out where the ASISs are and if they're level, if one side's a little lower or higher. So I'm just going to take a look at Fatty's ASISs and get a sense of feel of where they are in location. And their location is pretty good. They're fairly even. And after I do that, I'm going to have you, could you turn around for me, Fatty? Great. Come back towards me a little ways. Great. So I'm going to lift up here and locate the PSISs and find out where they are. And I'm going to do it's active movement of the SI joint. Active movement being hip flexion will cause the PSIS to rotate down. And what you want to find is that there's movement down and it doesn't stay in one position. So to assess the active range of motion, I'm going to have Fatty, could you lift your right hip for me? Great. And there's movement there. Great. And down. And lift your left. Great. There's movement there and down again. So I found that the ASISs are fairly even. That's what you're looking for. You want to find if the PSISs are even. And then you want to have the person do active hip flexion to see if the PSISs are moving down. From there, what I'm going to do is some joint play and some palpation of the area. And in the next video, I'm going to do the hip specifically. But there is a lot of effect. A lot of the muscles really affect the SI joint that are involved with hip movement. Okay, so we're going to have Fatty on the table down with his face straight down. And we're going to do some SI joint movement. Now, again, you're not going to be able to see this quite as well. McGee's gives you the 3 different types of joint mobs. There are multiple joint mobs for this area, but I'm just going to do 3 specific ones. The one is to, you're going to put your hand on the top of the sacrum. The other one is to find the ischial tuberosity. And what you're going to do is apply pressure down and up evenly on the sacrum and on the ischial tuberosity, and you're going to cause movement of the SI joint. So I apply pressure in moving in that direction, down. So you do that. From there, what you want to do is go on the iliac crest, okay, and the sacrum, but more on the coccyx area. And again, this is moving, one hand is moving down, the other hand is moving up. So again, you're stressing the SI joint in an upward direction, the other is a downward direction, and then the other one is applying your palm, or the palm of your hand on the sacrum, and the other hand on the ASIS, and you pull up with your left hand and apply pressure down with the right hand, causing, again, movement or stressing the SI joint. So again, when you do this, you're looking for pain, discomfort with any of those movements. If the SI joint is affected, or it's hypomobile or irritated, usually it'll show itself with joint play. Now I'm just going to come around here. After you've done that, you want to take a look at the musculature of the region. And again, this overlaps the hip. But you want to look at the glutes. You want to palpate for any kind of hypertonicity, irritation, muscle tone. You want to go around the 6 lateral rotators of the hip, around the greater trochanter. You want to palpate the gluteus maximus and minius and find if there's any kind of irritation, myofascial trigger point, referral patterns. Okay. You can also, from there, you can continue on down the lower leg, but what you're really going to do is focus in on here, and then when and if you do the hip, if you assess the hip, you go on and do more musculature related to that. So that pretty much covers the areas that you need to cover for the SI joint itself. Okay? And now you can go to Blackboard and answer the questions we put up there for you.